I'm Dr. Salman. Today we'll be teaching the ankle joint. आवाज आ रही है मेरी? So today we'll be studying about the ankle joint. Ankle joint, as you all know, it is also known as talocrural joint. Talocrural, between the crura and the talus. So it is the second name given to the ankle joint is the talocrural joint. We'll study first about the type of the joint, which type of joint it is. After that, we'll discuss about the bones or parts of bones making this joint. After that, the ligaments and all that. So we'll first start with the ankle joint. As you can see on the slide, the ankle joint is of hinge variety. It is a synovial joint of hinge variety. As you know, there are ball and socket joints, hinge joints. So this ankle joint is of hinge variety, a synovial joint. Now it is made of, mainly it is made of three bones. The lower part of the tibia, the lower part of the, some part of the fibula, that is the lateral malleolus, and the talus. Now I'll see the diagram. As you can see in this diagram, this is the lower part of the tibia. This is the medial malleolus. This is lower part of the fibula. And this is lateral malleolus. Now, this hole is the talus bone. You can see this hole is the talus bone. This is the body of the talus bone. So mainly the ankle joint is formed by articulation of this lower end of fibula, the lower end of tibia, along with the malleoli, articulating with the body of the talus bone. So this is your ankle joint. These three bone forming structures, this is your ankle joint, formed by the lower end of the tibia, the lower end of the fibula along with the malleoli, that is the medial and the lateral malleolus and the talus. So this is mainly the ankle joint. Now we'll come to the discussion. As I said to you that it is a talocrural joint, uniaxial, synovial, of hinge variety. The bones forming the joint, as I told you, the lower end of the tibia, the medial malleolus, the lateral malleolus of the fibula, and the articular surface of the talus. This is the articular surface of the talus surface. You can see the picture also. This is the lateral view. This is the lateral view. This is the anterior view. So you should understand this picture as is given in the picture. This box-like structure is for stabilizing this. So the shape of the talus, the shape of the body of the talus is that it will accommodate the lower end of the tibia, the articulating surface of the lower tibia, along with this fibula, so that this joint makes it the stable and stronger. You can see this gap. So this gap is filled by the articular surfaces of the tibia, the talus, and somehow the lateral malleolus of the fibula. So this joint, this forms the stability, and this gives the stability and strength to the ankle joint. Now you can see in the slide, it is made of, as I told you, it is made up of lower end of the tibia, then the fibula, then the talus. This is the whole talus, body of the talus. So tibia, fibula, and talus. This forms the ankle joint. Now, clear है अभी तक? आगे जाऊं? About the articular surfaces of the bones and the part of the bones forming the joint. ठीक है. Now comes the ligaments of the ankle joint. Ligaments are there to strengthen and stabilize the joint. With the help of ligaments, a joint is more stable and strengthened. So here in the case of the ankle joint, we have three main three main group of ligaments. One acting on the lateral side, that is this lateral side, lateral collateral ligament. One acting on the medial side, that is the medial collateral ligament. As you can see, this is the medial side, as this is the lower end of the tibia, this is talus. So this is the medial side of the foot, and this is the lateral side. In this slide, you can see the medial side, that is the medial collateral ligament. Then you can see the lateral collateral ligament on the lateral side, that is on the fibular side. So we'll discuss first the medial collateral ligament. It is the most important and the most strengthening ligament for the ankle joint. The medial collateral ligament, actually it is attached by its apex to the tip of the medial, to the tip of the medial malleolus, coming to the attaching on the medial aspect of the talus. So the medial collateral ligament is having two type of fibers, that is the deep layer and the superficial fibers. The deep fibers comes from the medial malleolus of the tibia up to the medial aspect of the body of the talus. Whereas the superficial layer, it has multiple fibers coming from the medial malleolus and attaching on the navicular tuberosity, sustentaculum tali of the calcaneum, and along with the medial aspect of the talus. So talus, calcaneum, and navicular tuberosity. This is the ligament attaching the medial surface or the medial malleolus of the tibia to the sustentaculum tali of the calcaneum. This is the ligament attaching the lower end or the medial malleolus of the tibia to the navicular bone. And this is, this is the ligament attaching the lower end of the media to the talus bone. So we have medial collateral ligament. Medial collateral ligament, we have two type of fibers, that is a superficial layer. The superficial layer are fibers. These attach the lower end of the media to the navicular talus and the sustentaculum tali of the calcaneum, to these three structures. Whereas the deeper layer or the deeper fibers attach only to the medial aspect of the body of the talus. This is the medial collateral ligament. You should understand this. This is important, and it gives more stability and more strength to the ankle joint as compared to the lateral collateral ligament. Now we'll discuss lateral collateral ligament. Before that, you should understand the medial collateral ligament. It is situated on the medial side. It has deep and superficial fibers. The deep fibers are arising from the tip of the medial malleolus, and they are attaching on the medial aspect of the body of the talus. Whereas the superficial fibers, these arising from the lower end or the medial malleolus of the tibia and are attaching on navicular bone, the talus bone, and the sustentaculum tali. It is a ridge on the bony ridge or landmark on the calcaneum bone. So this is the medial collateral ligament. Now we come to the lateral collateral ligament. Lateral collateral ligament, as I told you, it is more, less or weaker than the medial collateral ligament. It is situated on the lateral aspect of the foot, that is the outer aspect. And as you can see in the slide, there are anterior talofibular. Talofibular means it is attaching the talus with the fibula. Then the calcaneofibular, attaching the calcaneum bone to the lower end of the fibula. Then the posterior talofibular, that is attaching the posterior aspect of the lateral malleolus of the fibula to the talus. Okay, so the anterior talofibular, the posterior talofibular, and the calcaneofibular. These are the lateral collateral ligaments. The three slips are the three parts of the lateral collateral ligaments, giving further stability to the ankle joint. Other than these two medial and lateral collateral ligaments, the ankle joint is more strengthened by the tibia and the fibula are more held in position, held strong together by the anterior and posterior tibiofibular ligaments. Anterior and posterior, as you can see in this picture, this is the anterior view and this is the posterior view. So this lower end of the lateral aspect of the tibia is attaching with the lateral medial aspect of the lateral malleolus of the fibula through a ligament which is known as anterior tibiofibular ligament. Anterior ho gaya, tibiofibular, attaching the tibia and fibula together ligament. So this is the anterior view and this is the posterior view. This is the ligament attaching the tibia to the fibula. So this is further strengthening the ankle joint as strengthening the tibia and fibula. So mainly we have medial collateral ligament, lateral collateral ligament, then comes the anterior and posterior tibiofibular ligaments. Okay with it? We got the ligaments. Any problem in these 3-4 ligaments? I'll repeat it. Otherwise, I'll proceed. Please respond. Okay. Lateral ligament. As I told you, it is situated on the lateral aspect of the lateral or the outer aspect of the foot. So it has 3 parts. That is the anterior, the posterior, and the calcaneofibular. The anterior and the posterior parts of the ligaments attaching the talus to the lateral malleolus of the fibula to the talus. Whereas the calcaneofibular, as the name indicates, the calcaneofibular, so it is attaching the calcaneum along with the fibula. Then comes the medial collateral ligament. The medial collateral ligament, as I told you, it is divided into superficial and deep parts. The superficial part further attaches to coming from the lower end of the tibia and is attaching on the navicular tuberosity, sustentaculum tali, and the talus. This is the deep medial collateral ligament attaching the lower end along with the lowering end of tibia along with the talus. Whereas this is the ligament attaching the lower end of the tibia along to the sustentaculum tali of the calcaneum. Got it? Now, this is the deep layer attaching the lower end of the tibia to the medial aspect of the body of the talus bone. Okay. Okay, now I'll proceed to the relations. So far we have studied the type of joint. I'll repeat it, that is, it is a synovial joint of hinge variety. Then comes the articular surfaces. The articular surfaces are made by the lower end of the tibia, the lower end of the fibula along with the malleoli, that is the medial and the lateral malleolus, and the articular surface of the talus bone. So these 3 structures are forming the true ankle joint. Then I teach you the ligaments of the ankle joint. In ligaments, you have mainly the medial collateral ligament, then the lateral collateral ligament, and anterior and posterior tibiofibular ligaments. Medial collateral ligament is the strongest and giving more support to the ankle joint as compared to the lateral collateral ligament. The lateral collateral ligament is weaker than the medial collateral ligament. The medial collateral ligament is divided into deep and superficial parts. The deep part is attached from the is coming from the lower end of the tibia and is attached to the medial surface of the whole body of the talus. This is the deeper aspect. Whereas the superficial aspect, the superficial fibers coming from the lower aspect of the tibia or the medial tibia, medial lower tibia, and attaching on the navicular bone, the medial side of the talus bone, along with the sustentaculum tali of the calcaneum. So the superficial fibers are attaching on three bones, that is the calcaneum, navicular, and talus, whereas the deep fibers are attaching only on the body of the talus bone. Then comes the lateral ligament. Lateral ligament, as I told you, it is further divided into anterior, posterior, and calcaneofibular. Anterior and posterior, talofibular, and calcaneofibular. As the name indicates, the talofibular attaches from the talus to the fibula, that is the lateral malleolus of the fibula, and the calcaneofibular is attached to attaching the calcaneum to the fibula. Then comes the anterior relations, the relations of the ankle joint. So in ankle joint, some structures, that is muscles, vessels, these will be passing anteriorly, some will be passed posteriorly. So mainly the structures passing anteriorly to the ankle joint is the muscles. In the muscles, this includes tibialis anterior, extensor hallucis longus. Then comes the tibial vessels along with the deep peroneal nerve. So the extensor muscles along with the tibialis anterior and the tibial vessels along with the deep peroneal nerve. These comes in the anterior relations of the ankle joint. If you can see the mnemonic, it will be easy for you to remember. So tibialis anterior, the extensor muscles, the tibial vessels, and the deep peroneal nerve. These structures come in anterior relations of the ankle joint. Then comes the posterior relations. So the flexors of the foot along with tibialis posterior, you should note that in anterior relations is anterior, tibialis anterior, and this posterior is in the posterior relations. And then the tibial nerve, here we have, you can see here we have deep peroneal nerve. This is in the anterior relations, we have deep peroneal nerve. Whereas in this, you have tibial nerve. As you all will be knowing, there is difference in the distribution of the peroneal and the tibial nerve. The peroneal nerve is used for other action and tibial nerve for another action. So you should memorize this and not confuse in between this. The posterior relations, you can see the tibialis posterior, the flexor of the foot, the posterior tibial vessels along with the tibial nerve. This is the posterior relation of the ankle joint. Then comes the movement of the ankle joint. As I told you earlier, I will show a slide. In this slide, you can see, okay, this is the slide. You can see ankle joint is, as I told you, the ankle joint, the true ankle joint, it is formed by the tibia, fibula, and talus. So you will be having the dorsiflexion and plantar flexion, that is the foot coming upward and the foot going down towards the ground. These two movements on the true ankle joint. Whereas there is another term, as you can see, as the subtalar joint. Subtalar joint, as the name indicates, sub, below, talar, talus. So it is formed by in between the talus and the calcaneum bone in a fashion that talus bone lies on the top and calcaneum lies on the bottom. As you can see, this is the calcaneum, this is the heel bone, this is your heel, this is the calcaneum, and this is the talus bone. So this subtalar joint is formed between the calcaneum, this calcaneum, and this talus bone. These two bones, talus above, calcaneum below. These two bones form the subtalar joint, and the subtalar joint allows side-to-side motion of the foot, side to side. That is some degree of eversion inversion. Whereas the ankle joint, you will be having dorsiflexion and plantar flexion. Okay. So this is a ankle is a hinge joint, as you know, and permits movement in one plane around a single axis. That is the one is action is the dorsiflexion. The another action is the plantar flexion. In dorsiflexion, as you can see, your dorsum of the foot, from the tip to the this dorsum of the foot, this is moving towards, this is moving upwards. If you move your foot upwards in this direction, this is dorsiflexion moment, and this dorsiflexion moment, you are moving your foot away from the ground. Remember this. As the arrow indicates, you are moving your foot away from the ground. Away from the ground. Whereas in plantar flexion, you are moving your foot towards the ground, into the ground. As you can see, this is plantar flexion. This is dorsiflexion, this is plantar flexion, and these two movements are actually happening on the ankle joint. This is dorsiflexion, that is the foot moving upward, yeah, or away from the ground. And this is the plantar flexion, the foot moving towards or into the ground. So these two are the main actions of the ankle joint occurring at the ankle joint. The muscles producing the movement, dorsiflexion and plantar flexion, the main muscles are the principal muscles producing the movement is dorsiflexion is produced by tibialis anterior. Dorsiflexion, that is movement of the foot above the ground, is formed by the tibialis anterior muscle. Whereas plantar flexion is performed by the gastrocnemius along with the soleus muscle. Tibialis anterior is doing your dorsiflexion, whereas gastrocnemius along with the soleus is moving your foot in a plantar flexion direction, in plantar flexion moment. Then the muscles assisting the tibialis anterior in dorsiflexion are extensor digitorum longus, this one, extensor digitorum longus, extensor hallucis longus, and peroneus tertius. These muscles are these muscles are assisting the tibialis anterior muscle to help carry on the dorsiflexion, this movement. Tibialis anterior is the main muscle, and extensor digitorum longus, extensor hallucis longus, and peroneus tertius, these muscles assist the tibialis anterior in dorsiflexing the foot. When it comes to the plantar flexion, the gastrocnemius and the soleus main muscles are the principal muscles are assisted by the tibialis posterior, mind this, tibialis posterior, the flexor hallucis longus, flexor digitorum longus, and plantaris. अगर आप इस तरह याद रखें कि you should memorize it like that, कि extensors along with the tibialis anterior and flexors along with the tibialis posterior. So this will give you idea about the dorsiflexion and the plantar flexion. Tibialis anterior along with the extensors and the peroneus tertius, whereas the gastrocnemius soleus along with the flexors and the tibialis posterior, these carry on the dorsiflexion and the plantar flexion movements. So these two are the main movements occurring at the ankle joint. Moments clear है, moments में कोई query है, you can ask anything if till now. Mnemonic for what? Acha, okay, we'll proceed. Then comes the blood and nerve supply of the ankle joint. About the blood and nerve supply, as sorry, as you all know, it is a joint between the tibia, fibula, and the talus. So the main arteries supplying the joint will be tibial arteries. As you can see, here is written that malleolar branches of the anterior and posterior tibial arteries. You will be knowing that tibial artery is divided into anterior and posterior branches. So here comes that the malleolar branches. Malleolar branches means the branching supplying the malleolar aspects of the tibia. The malleolar branches of the anterior and the posterior tibial arteries. This is the main supply of the ankle joint. If you just remember the tibial arteries, it will not be enough. You should remember the malleolar branches of the tibial arteries, the anterior and posterior. Anterior and posterior is the distribution. Main artery is the tibial artery. Malleolar branches, malleolar show you the area supplying the artery. Then comes the nerve supply. As I told you, there are two types of movements mainly. That is the dorsiflexion and the plantar flexion. So we have branches from the tibial nerve, branches from the tibial nerve and deep peroneal nerve, and branches from the common peroneal nerve. Your dorsiflexion is done by the common peroneal nerve. If your common peroneal nerve is damaged, you cannot lift your foot off the ground. And your plantar flexion is done by the tibial nerve. If your tibial nerve is damaged, you cannot step properly. You cannot proceed your step properly on the ground, and it causes a foot slap. A foot slap just because you cannot hold your foot on the level. So the tibial nerve and the common peroneal nerve, the tibial nerve and the common peroneal nerve, these are the main supply of the ankle joint, supplying the muscles of the ankle joint, producing the dorsiflexion and the plantar flexion. Once again, I'll tell you that the tibial nerve and the common peroneal nerve, these two are the main nerve supply of the ankle joint, helping the dorsiflexion and the plantar flexion. This common peroneal nerve is responsible for the dorsiflexion, whereas the tibial nerve is responsible for the plantar flexion. You should know the difference of the two nerves. You should know the difference of the actions of the two nerves. You should know the difference of these nerves supplying the muscles. So you should not confuse that the tibial and the common peroneal nerve have the same action. One is acting on the dorsiflexion and the other is responsible for the plantar flexion. Got it? Clear? Hello? Clear? So far? Nerve repeat. Okay. As I told you, we have tibial nerve and we have common peroneal nerve. The tibial nerve is responsible for the plantar flexion movement. This is your plantar flexion. This is your plantar flexion movement. This is the tibial nerve, and this is the dorsiflexion movement, and it is performed by the common peroneal nerve. If your toe is pointing upward, if your toe is pointing upward along with your dorsum of the foot, this movement is caused by the common peroneal nerve. Now, likewise, if your common peroneal nerve is damaged, you cannot move foot in the upward direction. You cannot lift the foot. You cannot move it in the upward direction. This is the dorsiflexion, and it is carried by the common peroneal nerve. Then the plantar flexion, as you can see, you are moving your foot into the ground or towards the ground or approximating your foot to the ground. So this action is caused by the tibial nerve. The plantar flexion by tibial nerve, the dorsiflexion by the common peroneal nerve. This is very important clinical point. You will come through this in your vivas, in your exams, and clinically. So this point you should clear that there are two nerves. One is for plantar flexion and the other is for dorsiflexion. And these nerves are the common peroneal and the tibial nerves. Got it? Okay. Any questions regarding this? Any question in this ankle joint?